Hi everybody, this is Dr. Barb Fox, Holistic Veterinarian in Northeast Iowa, and I'm going to introduce you today to video number 2 of our vaccine series. We're going to talk about vaccine reactions. In my first video, we talked about the various components that are in the vaccines that can bring harm to the body, including preservatives, adjuvants, foreign animal proteins, dyes, emulsifiers, and stabilizers. In today's video, I'm going to talk to you about what to look for after vaccinations that are considered abnormal symptoms and should be reported to your vet's office ASAP. First of all, I want to stress that vaccination is a medical procedure and should never be taken lightly. If you must vaccinate, don't ever go to a vaccine clinic at the feed store or the pet food store. If your pet has what we call an adverse reaction, medical care will be needed, and unfortunately in a setting that is not in a medical clinic, you're not going to have access to the tools that you need to get that animal out of that reaction. So there can be severe reactions and there can be mild reactions. And although cases of severe reactions are rare, they can and do occur. Any kind of abnormal response to a vaccination should always be reported to your veterinarian, even if you're not sure the symptoms are really related to that or not. Let your veterinarian decide that. So there are basically two types of reactions. One is what we call acute, or that's immediate, and then chronic or late onset reactions. The most serious reactions occur within minutes or even hours after the vaccination, and may include facial swelling, especially around the eyes, difficult breathing, vomiting, diarrhea, extreme weakness, collapse, and even the passing of your pet. Late onset reactions may be seen as pain or tenderness over the injection site. Maybe they're a little more tired than normal. Maybe they don't want to eat for a day or two, and they might be running a low-grade fever. In rare cases, a lump may form where the injection was given, and you need to notify your veterinarian if you find a mass that is in the area where the inoculations were given. So if you have to vaccinate in the future, your veterinarian will probably pre-treat with either a corticosteroid or an antihistamine, maybe both, or at least avoid that area where that reaction occurred, where that little skin lump was. So any of these symptoms, however mild, should be reported to your veterinarian immediately. And make sure that they enter that in your pet's history so that proper precautions can be taken. So autoimmune diseases and disorders of virtually any organ system can occur following a vaccination. I'm just going to share with you a very true but very sad story. It's a case I saw several years ago when I had a house call practice. I was called to look at Max, who was an 11-year-old beagle. He was having some neurologic symptoms, and I was called to the house to give a second opinion after these pet parents had had a diagnosis from the University of Wisconsin of idiopathic encephalopathy, myelitis. I can't even remember exactly what the term was, but it was basically, we really don't know. We're just going to treat with anti-inflammatories. So when I first came to the house, Max was in his little pet bed, and he had these constant little head tremors, and he was shaking in different areas of his body. And that had been going on for several weeks. He also was not able to stand on his own for more than probably 15 or 20 seconds before he would get too weak and he would collapse. He did have a really good appetite though, and he passed his poop and his pee just fine, but he had to have help standing up when he was pooping. He had no prior history of medical issues or any disease. In the beginning, his conventional veterinarian prescribed antibiotics and steroids, but Max was pretty unresponsive to those treatments. So then he was referred to the University of Wisconsin for a neurological examination. The only thing that came out of it when they did a myelogram and a CAT scan was there's just a small amount of fluid at the base of the cerebellum. And so the cerebellum is the organ in the brain that helps the body keep balance, physical balance, and keeps everything coordinated. They didn't see any tumors, any cysts, or any other lesions anywhere in their scans. And Max had no history of trauma. So it was a very puzzling case. So again, they just gave it a general diagnosis of idiopathic neurological syndrome, which could cover a lot of things. And I got to thinking, what am I missing here? What were they missing? And then I started to question, the food, the supplements, everything that they were doing. And they said, when did Max have his last vaccines? And the pet parent said, well, he had his vaccines about 2 weeks before all the symptoms started. And I went, bingo. This has to be vaccine related. So I asked him, what did he get? Where did they get them? Where did he get vaccinated at? So on that day, he got the distemper, adenovirus, parvovirus, parainfluenza virus, coronavirus, 4-way leptospirosis, Lyme, Bordetella, and rabies, all on that same day, and all at the back of the neck. So we had a presumptive diagnosis of vaccinosis. Vaccinosis is just a broad term that covers anything that is adversely related to the vaccine. Now, could I prove that the vaccine caused Max's condition? No. There's really no test for that. Was there a probable correlation? Absolutely. So after I gave the pet parents my presumptive diagnosis, they decided to keep on going with Max. We started using essential oils, medical grade essential oils, some homeopathic remedies, herbal supplements, whole food supplements, and energy work in the realm of quantum physics. And they also hired an acupuncturist to come to the house to do treatments on Max because it was so hard to transport him. And he did get a little bit better, where he could move a little bit more, the tremor stopped, and that went on for a couple months. And then for whatever reason, his condition went south, and he deteriorated very quickly. And so at that point, Max's pet parents had to make that very difficult decision to euthanize him. But he had lived a year past the original diagnosis. So thank you for watching. I really appreciate the fact that you are interested in this vaccine series. And please hit the like button if you found this helpful, and also subscribe to the channel. And until next time, keep on the natural path. Blessings.